How to identify adult ADHD. ADHD is short for Attention Deficit Hyperactivity Disorder. It is a disorder of the brain in which certain areas of the brain are smaller than normal. These parts of the brain regulate the body's ability to rest, attention regulation and memory. You have likely always had ADHD, but perhaps you have just now begun to recognize that you may have symptoms. Your restlessness, lack of focus, and hyperactivity may cause challenges at work or in romantic relationships. Identify whether you have ADHD as an adult by looking for key symptoms and observing your reactions to everyday life. Looking for key symptoms of ADHD. Determine if you have symptoms of inattentive ADHD presentation. There are 3 presentations of ADHD. In order to qualify for a diagnosis, you must exhibit at least 5 symptoms in more than one setting, for at least 6 months. Symptoms must be inappropriate for the person's developmental level and be seen as interrupting normal functioning on the job or in social or school settings. Symptoms for ADHD inattentive presentation include: makes careless mistakes, is inattentive to detail, has trouble paying attention tasks, playing, doesn't seem to be paying attention when someone is talking to him or her, doesn't follow through chores, jobs, is organizationally challenged, avoids tasks requiring sustained focus like projects at work, can't keep track of or often loses keys, glasses, papers, tools, etc. Is easily distracted. Is forgetful. Determine if you have symptoms of hyperactive-impulsive ADHD presentation. Some symptoms must be at the level of disruptive for them to count in a diagnosis. Track if you have at least 5 symptoms in more than one setting, for at least 6 months. Fidgety, squirmy, taps hands or feet. Feels restless. Struggles to play quietly, do quiet activities. On the go, as if driven by a motor. Excessive talking. Blurts out even before questions are asked. Struggles to wait for his turn. Interrupts others, inserts self into others' discussions, games. Assess if you have combined presentation of ADHD. The third presentation of ADHD is when the subject meets criteria to qualify for both inattentive and hyperactive-impulsive criteria. If you have 5 symptoms from either category, you may have combined presentation of ADHD. Get diagnosed by a mental health professional. As you determine your level of ADHD, seek the guidance of a mental health professional to make an official diagnosis. This person will also be able to determine whether your symptoms can be better explained by or attributable to another psychiatric disorder. Think about other diagnoses you may have received. Talk with your doctor or mental health professional about other disorders or conditions that might have symptoms that are similar to ADHD. As if having an ADHD diagnosis isn't challenging enough, 1 out of every 5 with ADHD is diagnosed with another serious disorder. Depression and bipolar disorder are common partners. 1/3 of children with ADHD also have a behavioral disorder, conduct disorder, oppositional defiance disorder. 4. ADHD tends to pair up with learning disabilities and anxiety. 2. 5.